The Republicans are retreating and attacking at the same time today. The attacks we're used to, the retreat we're not. So what is that about? Well, it's about that Medicare plan. Man, they are running for the hills. They're so far up that hill, they're out of breath. Like, Jesus, Lord mercy, did we lose them yet? Democrats got them on the run on this one. The Hill reports that Senate Republicans are dropping Ryan's Medicare voucher plan entirely. It's not included in their new budget unveiled today by Pennsylvania Senator Pat Toomey. Wow, whoever want to run, whoever want to stay. They did not have that work out for them, and they are saying, you know what, it's time to attack something new. And they always gotta go on their attack, right? So what's new? Medicaid. Toomey's plan follows the Ryan model of turning Medicaid into a block grant program. Now, you know how much that cuts? The Ryan plan cuts at least $1.3 trillion from Medicaid. And a new report out today says that plan would add 44 million poor people to the ranks of the uninsured. Way to stay classy, guys. Of course, Washington will call this serious and grown up. Yeah, of course, when you attack people in lower income brackets, that's very serious and grown up. Going after rich people, oh, no, we would never want to do that. At least they learned their lesson on Medicare. Will they learn their lesson on Medicaid? We'll find out. Well, one of the guys they have to deal with is Democratic Senator from Ohio, Sherrod Brown, and he's joining us right now. Senator Brown, great to have you here.
How are you? Good to be with you. Thanks.
All right. So first, on Medicare, is it done? Is it, as Spike Lee would say, over, O-V-A-H, over?
No, I don't think they've. I mean, you say they've learned their lesson. I'm not sure they have. Every time they get a chance from the invention of Medicare in the mid-'60s, the passage where most Republicans opposed it, to the first time Newt Gingrich had a Republican House and Republican Senate, they tried to privatize, fell short. The first time President Bush, there was a Republican president, 2 Republican houses, House and Senate. President Bush tried to privatize Social Security. Now that the Republicans at least think they're on the ascendancy in Washington, they're trying again. They're going to keep trying because they don't believe in that a government program like Medicare or Medicaid, for that matter, can work for the public. And they found out when they went home, and particularly the freshman Republicans went home, and they unveiled to the sound of trumpets and ticker tape, or however they did it, this grand Medicare scheme under Paul Ryan's bill. They found out it wasn't so popular because the voters believe in Medicare. They know it works. They don't want some risky government, anti-government voucher scheme that is basically just going to shift costs to seniors. It doesn't save dollars like we're trying to do with Medicare as a whole to make it more efficient. It just shifts the cost from the program, from taxpayers, onto seniors, and that just doesn't work for people.
Well, it doesn't. That's probably why they didn't include it in their new Senate proposal today. And here's a letter from 41 GOP House freshmen, and I love this. This is the President Obama, and they are complaining about, quote, Medicare attacks against Republicans. We ask that you stand above partisanship, condemn the disingenuous attacks, and work with this Congress. Look, I'm going to be a little harsh, but it sounds like they're crying. They're like, oh, no, Mr. President, please have your party stop attacking our terrible ideas. Any chance you guys will listen?
No, it's funny they do that. I mean, it's not funny, but it's curious they do that because a lot of them last year went after Democratic House incumbents saying that Democrats were cutting Medicare. What we were doing is taking away insurance company subsidies that the insurance companies got when they were involved in the Medicare privatization program begun 10 or so years, 10 or 11 or 12 years ago. So the fact is these guys, of course they're complaining about it because they know we're being straightforward and we are attacking them for what they want to do to Medicare. But it's like when they accuse Democrats of class warfare. They're the ones doing the class warfare. We're just pointing it out. They're the ones that are trying to scare seniors and take away what we know works, a very good Medicare program that's been around for 45 or 6 years now. And we're just pointing out they're trying to undercut it and privatize it and shift costs to seniors. We're going to keep pointing that out. They're going to keep trying it because it's what they believe. They don't believe in this government health program any more than they believe in the health bill we passed a year and a half ago. They don't like Medicare. They don't like to say it that way, but they really fundamentally don't like that program.
Well, there's one other issue here, of course, as we pointed out, that's Medicaid. I want to show you an NBC Wall Street Journal poll. Medicaid also polls well. First of all, the most popular thing is raising taxes on millionaires for how to balance the budget. That's 81% saying they're in favor of that. Don't cut Medicare is at 76%, but don't cut Medicaid is also at 67%. That's 2/3 of the country. So will the Democrats have as much passion and fight in defending Medicaid as they did on Medicare?
Yes, we went through that a decade and a half ago, too, in the 90s, when Gingrich tried to block grant Medicaid. It's a non-starter. It hurts two groups of people. It hurts poor kids. They're about 2/3 of Medicaid beneficiaries are children. They're only 1/3 of the cost because kids don't get sick as much. The other part of Medicaid is seniors, many of them in nursing homes, low-income, moderate-income seniors who don't have a lot of assets. That's about 1/3 of the individuals in Medicaid, but 2/3 of the cost, because they're obviously cost more to take care of a senior than a child. So they're going after young children, going after poor children and low income, moderate income, low asset, if you will, seniors. And that ain't going to work either, because the public gets it. The public is on to these guys, how they overreach. They overreached in Ohio in what they're doing in collective bargaining. I mean, I've asked people to go on my website, sherrodbrown.com/Ohio, and sign up against what they're trying to do when they overreach in Ohio and taking away bargaining rights and going after women's rights. It's the same thing that they're doing nationally, and it's got to stop.
Right. Senator Sherrod Brown taking the fight to them today. I appreciate you being here.
Good to be with you.
All right. Now let's bring in Ezra Klein. He's an MSNBC contributor and a reporter for the Washington Post. Ezra, let's concentrate on that Medicaid attack that's coming now. $1.3 trillion, cutting 44 million people off of Medicaid. That is draconian. Are you as convinced as Senator Brown that the Democrats are going to fight just as hard on that one, or maybe not?
I am convinced that many Democrats will fight quite hard on Medicaid. Medicaid is very close to the heart of Democrats. It is a great society program. It protects truly the most vulnerable people in America. One group that Senator Brown didn't bring up were disabled. The bulk of Medicaid's costs come from the disabled, the people who really can't take care of themselves, the people who really can't go out and purchase their own health care insurance. So I think emotionally Democrats will be there. The problem for Medicaid is that its constituencies aren't as powerful.
Exactly.
More able-bodied, more able-minded seniors are stronger. And so even if Democrats are emotionally there to fight for Medicaid, they're not going to have quite the same interest group backup that Medicare does, and that could lead to an outcome where they beat back most of the attacks on Medicaid, but it still does get whacked in a way that Medicare simply doesn't.
I think it will, and I'll tell you why. And I don't want to be pessimistic. I hope they fight back, and I hope they win, right? But they got to do the spending cuts, and the Republicans are coming, and unfortunately, we're on Republican ground because we're talking about that debt commission, which was so conservative, which the president has, lauded over and over for reasons that I cannot comprehend. But Medicare affects us all, right? Social Security affects us all. So that's easy to protect because it's got a large constituency, as you said. Medicaid only helps the poor, the disabled, etc. Well, those guys are going to be easier to hit politically, aren't they?
They are easier to hit. I don't think Democrats particularly want to hit them. And one thing that will help Medicaid, one factor in this that isn't well understood, the Affordable Care Act, which Democrats really do care about protecting and in which this administration really cares about protecting. They really do see it as their entire legacy. The Affordable Care Act expands Medicaid tremendously. About half of the 32 million people who are going to be covered through Medicaid. So a sharp cut in Medicaid is essentially a direct attack on the Affordable Care Act. And a lot of Democrats are going to find that one to be a non-starter, too. They've been very united in repelling Republican attempts to repeal the bill, and they're not going to be much more impressed with Republican attempps to cut out the heart of the bill's coverage provisions, and then take
Ezra,
44 million people beyond that out of health care coverage.
Ezra, I hope to God you're right. But look, for the president, when he made his speech a couple of weeks ago and talked about how we're going to take 3 times as much from spending cuts as we are from tax increases, well, you got to cut somewhere, and so that's what I'm scared about. But now, look, if they don't do this, they do something called a cap act. Real quickly, can you explain to people what that is and why that might be even worse?
Are you talking the McCaskill-Corker cap thing?
Yes. That's right.
Yeah, so the McCaskill-Corker Cap Act, what it does is it holds spending down to 20.6% of GDP. And currently spending is around 23, 24% of GDP. And because we're going to have a big retirement boom in the coming years, the baby boomers are leaving work, we're going to have somewhat more spending because they're going to need Medicare, they're going to need Social Security. We'll have fewer working age adults. Essentially what the Cap Act does is it institutes something like it forces something like the Ryan Plan through the back door by saying that there's only one way to handle our fiscal problems, and that is sharply cutting spending and federal programs. You only allow one way to get out of this, which is a much smaller, much more restrained, much less efficient government, and you do it at the exact moment that you have a really large number of seniors retiring and a very significant unemployment problem, such that you're going to have a state that is completely incapable of dealing with the very problems that are facing it. It is, for Democrats to be on this act is a shocking thing, and I have just been baffled by the fact that McCaskill and Manchin and Lieberman and a bunch of others are there. Any Democrat who believes that Medicare and Social Security and the military should exist really can't in good conscience support the Cap Act because the numbers for those programs and that act simply don't add up.
Ezra, I couldn't agree more with you, but I'm not, except for the part where you're shocked that Lieberman and Manchin are on board. Of course they are. I mean, Lieberman, Democrat? Manchin? Okay, look, some of the top economists in the world, 75 of them, got together and said what the Cap Act is. Here, I'll just read it to you real quick. It says, such caps would require cutting or eliminating programs that are vital to the middle class, like Social Security, Medicare, and Medicaid. To put it bluntly, these plans would amount to nothing less than a Medicare kill switch. So this looks like a backdoor way of cutting all these programs without saying you're cutting it. So, all right, last thing on this. I know some Democrats have signed on. That makes it even scarier. Do they realize this at the end and go, wait a minute, we're not going to do this? Or do they actually go in favor of this, what appears to be a terrible plan?
I think so, and I think the Obama administration really has their hair on fire about this. They're getting really serious pushback on the Hill from the Obama administration, and also, I mean, center-left groups that tend to be thought of as centrist, like Third Way, are coming out and saying this is going to be like another Smoot-Hawley, which is the tariff act that was considered to be a contributor to the Great Depression. So there's going to be very, very broad agreement in the party against this act.
All right, Ezra Klein, thank you so much. Great discussion tonight.